If you're interested in healthcare, it's really, really critical to have that experience working in a hospital. And I think once you gain that foundational knowledge, it's really, really helpful whether you want to progress your career in the hospital or move outside of the hospital in the future.
Hi, everyone. It's Vrushangi Shaw with the Fellowship Review through the American Journal of Healthcare Strategy. Today, I am thrilled to be joined by Anjana Sreedhar. Anjana, thanks for coming on the show.
Thank you so much for having me. Looking forward to our conversation.
Yeah, it's so great to connect with you again. Of course, we've connected offline a couple of times, but for our listeners, Anjana and I met while I was going through the fellowship interview cycle 2 years ago, almost 2.5 years ago. So I love reconnecting with, old peers and people that I get to follow on LinkedIn. And so with that, Anjana, please tell our listeners about yourself. Just a brief background would be great.
Yeah, sure. So a little bit about me. I got my undergrad degree in international relations with a minor in Chinese at NYU, which you will soon see is going to become a theme. I took a break for 2 years. I worked in healthcare consulting in DC, and then I went back to school. I got my MPA in health policy and management from NYU's Wagner School of Public Service. And after that, I went straight into the administrative fellowship track. And I completed an administrative fellowship at NYU Langone's Tisch Hospital, which is also known as the main hospital in Manhattan. And I graduated from that program in 2022.
That's incredible. So let's take it a step back before we kind of dive deeper into your fellowship and your current role, which is also at NYU, which I think is
Exactly. Yes.
great.
Yeah.
You had two incredible internship experiences, one which was a grad intern and another that was a grad research assistant. So can you tell our listeners just how you went about getting those specific internships and what those experiences were like?
For sure. So I think for me, what was really valuable was having experience both during the school year and for the summer. So I can speak briefly to my grad intern experience. So this was me really wanting to get hospital operations experience on the ground, having worked in healthcare consulting and research previously. I'd never worked within the four walls of any place that delivered care. And so I was really excited to be a graduate intern at the Montefiore Health System, which is located in the Bronx in New York City. And I got to work on a really amazing project courtesy of the Greater New York Hospital Association Summer Enrichment Program. So, what they do is they pair interns with different hospitals, and you get a preceptor. And you also get the opportunity to work on a particular project with your preceptor. So, I had the opportunity to look really closely at claims denials in our surgery/periop department at Montefiore and trying to understand what were some of the reasons for those denials. Are we inconsistently billing for certain procedures and certain implants? And for me, that was really interesting because I think in the context of graduate school, we learned so much about, the actual process of delivering care to a patient or supplies management and that sort of thing, but never really what billing and insurance claims and that sort of process looks like. So it was really eye-opening for me to have that experience, and obviously had the opportunity to sharpen my data skills, to present some solutions to senior leadership. And I think all of that set me up for success in terms of applying for an administrative fellowship. In terms of the research assistant position, I love reading, writing, research, that sort of thing. I knew that I didn't want to get a PhD, but I still wanted to have a foot in the world of healthcare theory and things like that. And so I had the opportunity to work with a professor of mine who taught the management and leadership core class at NYU's School of Public Service, known as Wagner. And so I was able to work with her on putting together a lit review about the voice of healthcare workers and how, oftentimes in a team setting, as we know, healthcare in the hospital setting in particular is very hierarchical. So, what are ways in which health systems are allowing people who are quote unquote at the bottom of the hierarchy, such as medical assistants, scrub techs, medical secretaries, et cetera? What are health systems doing to actually engage with them and get solutions from them and create an environment of safety where they feel like they can speak up? So that was really interesting for me because I got to understand sort of the research aspect of trying to gather this kind of information and then also think critically about how many hospitals and health systems have found a best practice in actually helping these healthcare workers find their voice.
Yeah, absolutely. What incredible experiences. And for our listeners that are, listening into this episode, a little surprise and a fun fact about Anjana about how I know that she likes writing so much, but that's later on in the episode. So now, like moving along your career journey, right? So you do these internships, you get this experience, you're in grad school. What really led you to decide that instead of going back into consulting or getting a job out of grad school, you were specifically going to do an administrative fellowship? What motivated you to make that decision?
No, that's a great question, and something that I definitely grappled with when I was in grad school. So I know for me, when I was doing healthcare research and consulting, what I had found was in conversations with the healthcare executives that I was working with or speaking with, a lot of them were, sort of interested in why I chose to work in consulting without having a background in hospital operations, which made me realize that no matter who you are, if you're interested in healthcare, it's really, really critical to have that experience working in a hospital. And I think once you gain that foundational knowledge, it's really, really helpful whether you want to progress your career in the hospital or move outside of the hospital in the future. And so for me, I was thinking to myself, where is the best place where I can learn the most and also have exposure to senior leadership, get to work on really impactful and meaningful projects and things of that nature. And I felt that the goals of an administrative fellowship really lined up with what I was seeking to do professionally. And I can definitely say, as someone who went through an administrative fellowship, that it did do those things for me. And I do feel like I have a very good understanding of how a hospital works, how patients receive care, and how basically the wheels turn every day in a hospital.
Yeah, absolutely. And, a lot of the reasons why you highlighted doing a fellowship, are common reasons, not only with me, but also other fellows. So I appreciate you kind of highlighting that. Before we dig deeper into what your specific fellowship experience was like, maybe some of the projects that you did in your preceptor, for those listeners that are interested in NYU, could you please set up the stage on what that fellowship looks like? Is it 1 year? Is it 2 year? Is it just you as a fellow? Are there multiple fellows? I think the most important question that I get asked is it rotation based or project based? So could you please tell us the logistics of the NYU fellowship?
Sure thing. So, in terms of the logistics of the NYU Fellowship, I think one of the key distinguishing factors is that it's not necessarily a 1 or a 2 year fellowship. You get to decide. So, you can opt to do 1 year or you can opt to do 2 years. And I think that level of flexibility is really unique in a fellowship program. It is mostly project based. But I will say that the fellowship starts out with what we like to call rotations. They aren't rotations in the formal sense, but you get an opportunity to have like meet and greet sessions with various leaders, not just in your specific hospital, but across the health system. And I should zoom out a little bit more and say that NYU is comprised of is comprised of 5 fellows, and so you have 2 fellows at the Tisch and Kimmel Hospital, which I mentioned is the largest hospital in the system. 1 fellow at the orthopedic hospital, which is also located in Manhattan, and then you have 1 fellow in Brooklyn and 1 fellow in Long Island, and NYU Langone has hospitals in both of those places as well. So that rounds us out to a 5 person cohort in terms of the fellowship.
That's incredible. One thing you said really stuck out to me because it's such a unique part of fellowships, I think specific to NYU. You said there is either the option of doing 1 year versus the option of doing 2 year. So, do fellows have to decide this at the beginning of their fellowship? And can they change their mind if they wanted to, let's say, at the end of the 1 year, extend another year? Is that an option, or are fellows kind of locked in once they make that choice?
That's a good question. So I guess what I've learned in my experience is that you're usually having to make that 1 year versus 2 year decision pretty quickly within the first couple months of the fellowship. And I've never heard of anybody wanting to extend or roll back. And the reason perhaps is because people are really aware of how people wanting to extend or roll back can affect the following year's recruitment cycle. And so I think all of us as fellows are very sensitive to that. And so in my experience, we haven't really had people who have changed their minds, but what does end up happening in that initial phase when you're making the decision, people tend to talk to a lot of former fellows to kind of understand, what did you do? Why did you make this decision? Et cetera, et cetera. And that's, I think, having a pipeline of former fellows to speak with, not just about big decisions like this, but also post fellowship career advice and, advice in general. I think that's also one of the big strengths of the program. But to answer your question directly, folks don't often, or at least not to my knowledge, change their minds after they make that decision.
No, that's absolutely incredible. So kind of, you kind of set us up for success for my next question. But why specifically did you pick NYU? What was kind of that fellowship interview cycle like for you, prepping for interviews, and then what ultimately led you to pick this fellowship over, the many options that I'm sure you had?
Yeah, absolutely. So I think for me, what stood out to me about NYU is obviously I felt like I knew the system super well, and that's not just because I went to NYU twice. I think I also had the opportunity to speak to a lot of fellows, and I think for me that's obviously really helpful. And I think that's helpful for anybody who's looking to do a fellowship to really spend time getting to know the people who are either currently fellows or were fellows in the past, and I think that kind of gives you a perspective into what kind of people the organization likes to hire from a culture perspective, from a teamwork perspective. So I think for me, that was really important. And I also wanted to work at an organization that was, cutting edge and always looking to improve. And NYU definitely has that reputation. And the last thing I'll say is that NYU really uses data to make, data driven, informed decisions. And the one thing that I heard every time I spoke with either a current fellow or a former fellow when I was, fellowship hunting was that everything that we do here revolves around the data and there's a lot of sort of technical focus on that and I wanted to be at a place where any decisions that were being made from a place of looking at the numbers and using logic to move forward. And so to me that was really really important. And I would say the final thing that really struck me is the commitment to health equity. And what's really interesting about NYU is that it serves, as you can imagine, a very diverse patient population covering a lot of different geographies, a lot of different patients with a lot of different types of complex challenges, whether they're social or clinical. And it seemed to me that NYU seemed really committed to standardizing or at least having one high quality standard of care for all patients, regardless of where they go to seek care within the system. So all of those factors to me really spoke out and, made me think that I really wanted to first apply to NYU. And then obviously to answer the other part of your question, I had a really solid interview experience. Anytime I had a question, folks got back to me right away. I think just sort of the basic HR niceties were met, which I think are really important because how people engage with you prior to and throughout the interview process gives you a keen insight into how the organization works and how they might welcome a new team member. And so for me, I had that really positive experience. I had one round in person all day, the whole nine individual interviews with execs, a case interview, all of that kind of stuff. But I would say that it was a really positive experience. And it felt like I was just having conversations with people. It didn't feel like, I'm being judged or at this really high stress, high pressure sort of situation. So I appreciated that they put us all at ease. And then finally, when I got the call, I was like, I think this is where I'm meant to be. And that's how I made the decision.
Yeah, absolutely, absolutely. A couple of things that you said, really stuck out. I think, of course, NYU's reputation incredible, and even the news that I follow, they talk about that cutting edge technology. But the two other pieces that I love that you highlighted was the data piece and the health equity piece. I think data informs so many decisions, so I love that there is an emphasis on that within your health system. And then, of course, I think also someone who cares about health equity with such a diverse population, in the United States in general, but specifically, I would say in New York and California, I completely understand why there would be an emphasis on health equity, diversity, and inclusion. And so then, taking a step back and looking at your fellowship experience, what was, the mentorship like? Who was your identified mentor or preceptor? And any projects that you want to highlight that you did during your fellowship that were very impactful?
Absolutely. So I think what's really neat about a fellowship, or at least my experience in the fellowship, was that obviously I had an identified preceptor who was a VP of hospital operations, who made herself very available to me in terms of any questions I had if I needed her to look over something before submitting. Like I think she made herself really open and available to me. And I think she also did a really great job championing me if I, was doubting myself in a particular project or if I indicated interest in something, she was the person who spoke my name in those rooms. And I think that's just an outstanding example of not just what it means to lead, but also to mentor. And so I've learned a lot about what does it mean to be an effective mentor from her. But I also, I would say I also had mentors in the form of other fellows, other VPs, other senior directors that I worked with that I established really close relationships with. So I think for me that was really important.
Yeah, absolutely. And, I always say this. For me, mentorship is incredibly important. And identifying and finding a mentor who's gonna advocate for you, who's gonna teach you, and most importantly, say your name in rooms where you are not present is such a gift. So I'm so happy to hear that you were able to identify that person, not only in your direct preceptor, but other people within the organization. And so, one other question that I get a lot when people ask about fellowships that have multiple fellows, do you get to work with your co-fellows? Do you get to do site visits at the other locations? What's that dynamic like?
Yeah, absolutely. And I realize I didn't answer the last part of your question, which was to give an example of a project that I worked on. So I'm going to kill two birds with one stone
Do
by
it.
telling you
Yes.
about a project that allowed me to work with another fellow. So I think what's really neat about a cohort based model is not only are you actually going through the fellowship together and you can lean on each other during the tough times and celebrate the wins as a group, but you also get to work on projects together. And so some of the projects that we worked on were, network wide, if you will. So it involved all five of us. But one of the projects that I remember most fondly was working on figuring out if a patient was admitted to our emergency department in Manhattan, how that patient would then be transferred to Brooklyn if they were a psychiatric patient. And the reason this was important was because at the Manhattan hospital, we were not in a position where we could admit involuntary patients just because we didn't have the appropriate certification for it, but our Brooklyn hospital did. So we were trying to come up with, what is the appropriate workflow to make sure that if a patient comes to the Manhattan emergency department, they're identified as an involuntary admission. How do we get them to Brooklyn safely and how do we get them to a bed safely? And so I was able to work not just with, everyone that you can imagine, right? The emergency room, clinical leadership, the psychiatric clinical leadership at the hospital that I was at, but also with my Brooklyn fellow and the emergency department and psychiatric leadership at that site. And obviously, we have a comprehensive transfer center that's responsible for patient placement and transferring patients between hospitals in our system. And so we were able to work with that team as well to try to come up with an appropriate workflow that doesn't just meet the operational needs of the hospital, but also prioritizes the patient's clinical needs as well. So that's an example of a project where I got to work with specifically one fellow, but then obviously some of the larger projects, such as large survey submissions or anything having to do with joint commission. Those were the sorts of things that we would work on as a group. And then obviously anything having to do with administrative fellowship recruitment, whether it was webinars or reading candidates' applications and all of that kind of stuff, we also worked on as a group.
Yeah, that's incredible. And of course, recruitment is the first project that fellows are assigned. The funny joke, at least that within our fellows, is that you start the fellowship and immediately you're looking for your replacement, which
Yeah.
is the funny nature of fellowships for sure. But thank you for highlighting, that this fellowship allows you to work with your co-fellows, and also what an incredible project to kind of spend some time in the ED and transfer center as well. And so of course you ended your fellowship and you stayed at NYU, which is something we love to see. We love fellow retention. So tell our listeners, what is it that you do now? I know you're with the Cancer Center, but what specifically does your job entail, and maybe what's your favorite part about your job?
Yeah, absolutely. So currently, my formal title is that I'm a project manager at NYU's Cancer Center. And what that means for me is I get to work on a number of different operational and strategic initiatives. So from an operations perspective, I'm in charge of three disease management groups, or what we call as DMGs in oncology. And what that basically means is I'm tracking operational efficiency metrics like how long does it take for a patient to schedule a new appointment, how long is a patient waiting in the waiting room to be seen by the physician, that sort of thing. But I also partner with our clinical leaders to identify clinical quality metrics, make sure that we're tracking those. And obviously, that requires sufficient partnership with our analytics team. Can we pull this metric? Can we track it? If we can't track it, is there a smart phrase we can use? That sort of thing. So that's sort of from a more operational perspective. Those are some of the things that I track and assist with. But then from a strategic perspective, I really help oversee a lot of our cancer care in Brooklyn. And what I mean by oversee is I'm really responsible for things like patient mapping. So if you're a patient who has just been newly diagnosed with cancer and you live in Brooklyn, what is your first step? And where, how do you get to that first step, whether it's imaging or seeing an oncologist? What kind of oncologist do you need to see? Where are they located? That sort of thing. And so I think for me, that's really helpful and really important because it allows me to think both in a very detail oriented way, but also in a very big picture kind of way. And I think, obviously some jobs you do a bit more of one versus the other. And I think as a fellow, you're doing a lot of detail oriented work. And so it's kind of nice to be able to zoom out a little bit and say, like, this is why this strategy is important. This is why this plan is important, that sort of thing. And so I really have a unique opportunity, I think, to work with clinical leaders to establish what our clinical quality metrics look like, figure out how to expand certain initiatives and programs that require referrals from oncologists, that sort of thing. So for me, I'm learning a lot about strategy, a lot about operations, and program management all rolled into one, which I think makes my role really exciting.
Yeah, yeah, absolutely. I love to hear it. And so, kind of the last couple questions that I love to ask. Personally, having been to New York, I have my favorite spots that I love to go to. But, a lot of fellows may not have had the chance to visit New York and might be interested in applying. So, what's your favorite part about living in New York? Any highlights that you want our listeners to know about living in the areas where NYU's health system is located?
Yeah, for sure. So I would say take this with a grain of salt because I think, again, given NYU's presence and the fact that we have 5 fellows and we're, all of us are a bit spread out, what I have to share comes specifically from where my hospital was when I was a fellow, which was on the east side of Manhattan. And I think for me, I mean, I think in general, everyone can say the same thing. New York is just such a vibrant and cool and exciting place. And I think every day is an adventure. And, I've lived in New York for a very long time. And so sometimes I forget and I'm just like, please move out of my way. But I think it is a place where there's a lot of magic and it does feel like there is an air of anything is possible if you put your mind to it and you get to meet all kinds of really exciting and cool people who may or may not work in healthcare. So you get to make really meaningful connections across industries. And so for me, that's what really makes New York special. But in terms of really special places, I would say it's sad and ironic, but when I started the fellowship, it was at the height of the pandemic. So a lot of the places that we like to go to have been closed or they've moved on. But I will say, honestly, there's a bagel place across the street from the main hospital that has saved me many a time, and that's because they open super super early and they close super super late. And I think when you're a fellow, you're usually the first person in, the last person out, and so you start to find and identify the places that are open the longest and where you can just grab something really quick to eat. And I think all of that is really important. Another big cool thing about NYU's hospital, for those of you who ever have the chance to go, whether you're interviewing there or visiting family there or whatever, there's really good outdoor space in the hospital. There's a really nice pavilion or a really nice outdoor space on the 7th floor of one of our buildings. It overlooks the East River. So it's just a very sort of healing place to be. And whenever I was super stressed out about anything as a fellow, I would just, go outside and, you're going outside without actually leaving the building and you're getting to kind of experience the closest thing you can experience to nature in Manhattan. So I think for me, that's a very special place, even though it may not be like a New York City famous place.
Yeah, absolutely. Sounds like it. And there is a certain level of magic in New York. I think every time I visit or every time I've had the opportunity to spend a little bit of time in any part of New York, it's just been so incredible. So I highly recommend that whether you go there for the fellowship, take a moment to stroll and take in all the beauty that New York City has to offer. Of course, I'm going to ask that surprise last question, but
Let's hear.
before we get to that, I
Okay.
last fellowship question that I'd love to get, your take on because you've mapped out such an incredible journey for yourself and successfully completed the fellowship and stayed on at the org if you had to redo that cycle, or if you had one piece of advice to give a potential candidate, do while they kind of manage going through a pretty intense interview cycle, what would that advice be?
Yeah, absolutely. And I know this is something that you and I discussed before you hit record, but something that I think is really, really important is for candidates that may not have a ton of, specifically healthcare experience, but may have other experience in other fields. It's really important to not view that as a detriment to your application. And the reason I say that is I speak from personal experience. As I mentioned at the top of this conversation, I studied international relations. I thought I wanted to be a diplomat. So I had a lot of, journalism experience and writing policy memos and briefs, and very different sort of skill set compared to what one might expect from someone who wants to go into hospital operations. But for me, I was able to really talk about those experiences in a meaningful way and say, hey, because I am able to, I wrote a bunch of articles for this news site. I know how to tell a story and I know how to use data to tell a story. And that's going to be an important skill for me if I become a fellow at your organization. So I think really being intentional about recognizing what your experiences are and allowing yourself to take those experiences and create a cohesive narrative to say, I have all of these skills. They may not be specifically in healthcare, but I have all of these skills that are highly applicable and would make me a really good fit in your organization.
Yeah, absolutely. Great advice. And so usually this for the listeners that have been tuning in, usually this is where I end the episode. But like I promised, there is a surprise. There is a bonus question specifically for Anjana. So I know this because I have stayed connected with you and followed your work over the last several years. But on top of having a successful healthcare career and kind of this NYU legacy, if you will, Anjana is also an author. So tell our listeners you're published about the book that you wrote, why you chose to write it, and what kind of that process was like for you.
Yeah, absolutely. So, very quickly, my book is titled Healthcare of a Thousand Slights. It was published in December of 2020. And to kind of provide a quick synopsis, it's basically about the history of health disparities in the United States among marginalized populations. And in its thesis, it really seeks to answer the question, why are our health outcomes among certain populations the way that they are? Why is our health system the way that it is? And what are the things that we can do to fix it? And so, obviously, lots of big questions that I'm trying to answer in the book. And the way that I got started with this is I've always loved to write. I wrote for my high school newspaper, college newspaper, all of that kind of stuff. Um, but the way that I got started is I, post a lot on LinkedIn, as Vrushangi knows. And so I was approached by a really nice Georgetown professor, Eric Custer, who mentioned to me that, he liked my content and he thought I would be a good fit for his book writing program, which my first thought was like, there's no way this is real. But then I looked into it and it was definitely real. And so what his program does is it really teaches you how to write for a broad audience. And for me, my goal was really, how do I make healthcare come to life, healthcare and history come to life for people who have no familiarity with it whatsoever?
Mhm.
And so I was really interested in being able to, be robust with the research, but also be approachable with how I was talking about healthcare concepts. And so his class really helped me figure that out. He had a partnership with an independent publishing company. And so once they read the manuscript, they liked the work. I was, given editing support, copywriting support, all of that kind of stuff. And so it was really cool and exciting to kind of go through that entire process and really come out with a book at the end. So I'm really grateful that I did it. And I think I'm really proud of it. I've heard good things about it from other people. And hopefully it's a book that continues to impact people and it's something people will continue to be interested in reading.
Yeah, absolutely. And how incredible that you get to have kind of this healthcare title behind your name, but you also get to say, you are an author. And where can people buy the book? What would be the best way to go about purchasing your book?
Yeah, absolutely. Honestly, you can get this book wherever you buy books. I know Amazon is a popular spot for a lot of folks to get books. But if you're not an Amazon person, you can buy at Barnes and Noble. I don't even know what other places people buy books. And I'm working on getting it accessible at public libraries as well, because I recognize that public libraries are really the foundation for how we're able to disseminate knowledge at a very affordable way. But for right now, I would say Amazon, Barnes and Noble, wherever any sort of major bookstore, book chain, it would be a good place to get the book.
That's incredible. Well, Anjana, thank you so much for coming on. I know you're, a couple hours ahead of me, so it's, the end of the night for you, but I appreciate you joining and, sharing this incredible journey that you've had, maybe in a non-traditional sense. You said you wanted to be a diplomat, and look at where your life has kind of taken you, and you ended up doing a fellowship successfully, working still at NYU, such a great health system, and of course sharing your story of being an author. I really enjoyed speaking to you, on tonight's episode, and I know our listeners will also get a lot of great advice from this episode as well.
Thank you so much, Vrushangi. I had such a great time chatting with you, and I hope your listeners enjoy this episode.
Yeah, absolutely.